Mitochondrial encephalopathies. So these are group of disorders caused by mitochondrial DNA mutation. The various disorders are MELAS, MURPH, Elsane, Elhorn, KSS, NARP. Okay, MELAS, MURPH, Elsane, Elhorn, KSS, and NARP. Let's see one by one. MELAS stands for mitochondrial encephalopathy. That is MELAS. Okay, ME. LAS is lactic acidosis and stroke. So MELAS is mitochondrial encephalopathy, lactic acidosis, and stroke. MERF is MERRF. ME is not mitochondrial encephalopathy. ME here is myoclonic epilepsy. RRF is ragged red fibers. So MERF stands for myoclonic epilepsy with ragged red fibers. And then Elsane. Elsane stands for League Subacute Necrotizing Encephalopathy. League is L, SA is subacute, NE is necrotizing encephalopathy. L-horn is LHON. L is Leber, H is hereditary, ON is optic neuropathy. Leber hereditary optic neuropathy. KSS is Kearns-Sayre syndrome. Kearns, Kearns-Sayre, Sayre, Sayre syndrome, KSS. And then NARP. NARP is NARP, that is neurogenic weakness with ataxia and retinitis pigmentosa. NARP, N is neurogenic weakness with ataxia, Na, and RP is retinitis pigmentosa. Mitochondrial disorders are always maternally inherited. One important acquired mitochondrial encephalopathy is Reyes syndrome. REYEs. Okay, so Reyes syndrome. Let's see about Reyes syndrome now. So like mitochondrial encephalopathies include MELAS, MURPH, Elsine, Elhorn, KSS, and NARP. Let's see about Reyes syndrome. Reyes syndrome is a metabolic mitochondrial disorder characterized by three things: one with the brain, one with the liver, one with the kidney. With the brain, it's encephalopathy. With the liver, it is fatty liver infiltration. And one with the kidney is fatty kidney infiltration. So fatty infiltration of the liver, fatty infiltration of the kidney, and encephalopathy. So it is also known as encephalopathy with fatty degeneration of the viscera. It is acute self-limiting metabolic insult resulting in a generalized mitochondrial dysfunction because of inhibition of fatty acid oxidation. So like there is a process which is happening in the body, it's called fatty acid oxidation, that is not happening, which is why there is a mitochondrial dysfunction. This mitochondrial dysfunction gives a metabolic insult which causes fatty infiltration of all the organs, viscera. Okay, it is precipitated by two things: viral infections and aspirin. Okay, the drug which is used to treat like fever. Okay, so viral infection and aspirin, which is acetyl salicylic acid. Viral infections which can cause this include influenza A, B, varicella, which is herpes type 3, ecovirus, adenovirus, Epstein-Barr virus, Coxsackie virus. Influenza, varicella, Epstein-Barr, Coxsackie, echo, adeno. Echovirus 2, okay, and adenovirus. All these things can cause it. Clinical manifestations of Reyes syndrome. There is hepatic encephalopathy and brain edema. There are five stages for clinical picture. Stage 1, 2, 3, 4, 5. 1 the person is Q Walsap. That is Q is quiet, V is vomiting. Okay, and then okay, so like okay, so quiet, lethargic, sleepy, vomiting, anorexia, apathy. And then stage 2 instead of being just lethargic, they become deep lethargic, and then delirium, restlessness, agitated, hyperventilation. Stage 3 light coma, decorticate rigidity. Stage 4 seizures, deepening coma, and decerebrate rigidity. So stage 3 light coma, stage 4 deepening coma, stage 3 decorticate rigidity, stage 4 decerebrate rigidity, stage 5 deep coma, flaccidity, loss of reflexes, and respiratory arrest. We see it again, okay?